Hello, my name is Veer. I'm 2 years old.
Veer's a real character. He's smart, funny, adventurous, full of beans, and he's very cheeky. But underneath his healthy exterior, Veer's body has been hiding a very rare genetic disorder.
I got anemia. You gonna help me?
This means that his bone marrow is not producing enough stem cells, and so his blood counts are dropping. He will always have a higher risk of certain cancers, but soon he will need a stem cell transplant. Due to his Asian origin, Veer only has a 20% chance of finding a good match. Unfortunately, no one in our family is a match, so now we are relying on the generosity of an unrelated stem cell donor from anywhere in the world. All it takes to register to become a donor is a cheek swab. You have the rare opportunity to save a life of someone like Veer's, so why not take it? There really couldn't be an easier way to save a life.
And thank you, Fiona. Thank you, Rajal. Thank you, Anuja. And thank you, Vivek, very much for the fantastic presentation. Actually, you've answered a lot of the questions during the presentation that were being asked as well. So we haven't got that many questions to go through. Just a couple of things. One for Anuja. Anuja, when Fiona mentioned that there's a possibility of some new blood tests being available for Alzheimer's at some stage, at some point. When do you think this may be, and if it does come through, how would you normally know that this is available and people can have the tests?
I'm not sure at what stage it is. Any drug that is discovered or has to go through very vigorous tests and has to be approved by NICE, the National Institute for Clinical Excellence. So I'm not sure at what stage this particular test is, and obviously depending on where it is, it will be available. It could be many months, it could be years. I don't know.
But if it is available, presumably you would have, and you would be using this testing service.
Again, that depends how useful the test will be, and whether initially most things that come out are for use in secondary care by the consultants, and then when they're more widely available, do we get access to it in primary care?
Okay, thank you. Neville?
Hi, Anuja again, sorry, this one's for you. Palliative care for dementia patients, what sort of palliative care do we actually have for dementia patients?
So there is a gold standard framework where any patient that we suspect is palliative or terminally ill and palliative is referred to the gold standard service framework, and there are a group of district nurses and palliative care nurses who actually visit the patients at home, and they assess the patient, and they provide equipment such as hospital beds or any other equipment that's required. And just like any other palliative patients, these patients can also have needs such as they can have agitation, they can have breathing problems, they can have pain. So because at the end of life you're not able to swallow medication, they put up syringe drivers, where medication are actually given through a syringe driver subcutaneously. So all these things are organized by this palliative care team, and just like any other palliative care.
Anuja, just leading on from that, if, let's say, a dementia patient did not have an LPA or anything in place, so no one was there to make decisions on their behalf, how is care then administered at that stage?
So we make a best interest judgment, and we do whatever we consider the patient's wishes, previous to them losing their mental capacity. We ask friends and family, what his preference would have been, and make a best interest judgment depending on that. There is IMCA, which is an independent mental capacity advocate. So if there's a dispute and we're not able to make a decision, we sometimes refer to IMCA, and they then make a best interest decision for us.
Okay, thanks.
Sorry, I think just a quick generic, I think Fiona touched on this about the fact about getting the NHS to respond to dementia patients, just like there is a response to cancer patients. Obviously, I presume, Manish, this is a question for you. I presume that the Alzheimer's Society is having some success along this route, although obviously there's a lot more lobbying that needs to be done, but there is some success in terms of trying to get recognition for dementia.
Yeah, I mean, the Fixed Dementia Care campaign, which started last year, but actually for the last, I'd say for over the last 10 years, Alzheimer's Society has been advocating this constantly, and with all successive governments that have been in place. But if there's one hope that I have, through this COVID crisis, is that given the extent of the impact on dementia, the patients especially, and the excess deaths that Fiona referred to, I think the public sentiment has really changed, and I think the government has to do something about social care. So if there's some hope that comes out of this current crisis, I hope that at least the government can start having that conversation and doing something which perhaps 6 months ago would have been a step too far.
Thanks. Nirmal?
Yeah, so I'm going to put this out to the whole panel. Manish, I'll start with you and then we'll go around. There is a lot of information out there, resources out there available for dementia. And you've shared those with the stuff that we have, which you shared on the resources slide as well. But one of the things that we wanted to sort of check was, what is your thought on the delivery services? Do you feel that they're too fragmented at the moment? Delivery of the services around dementia.
So I'll try and be short in my answer on this, because it is a fairly complex area in terms of how is dementia, how are dementia services delivered. So Fiona mentioned, everything under dementia. Once you get diagnosed with dementia, the healthcare system doesn't really have an ongoing role unless you have a medical condition associated with dementia itself. But otherwise, the social care system takes over. And because social care is organized on a locality basis, so your local authority typically is the one who is responsible for provision of social care. So in the context of dementia, by and large, it is means tested. So, you're not going to get a lot of help if you have a certain amount of financial resources. And that's why it is important to navigate and through the Alzheimer's Society website. So I would encourage everybody to go through the website, because we've clearly faced this question a lot with anybody who has got this diagnosis. So there's a specific link that I've shared, which is, find the local resources in my area. So if you put your postcode into that particular bar, that gives you what are the different services on offer in my area. In certain areas, the local authority has a contract with Alzheimer's Society, and we're providing dementia support workers, etc. So that's what happens. But I would start off from the Alzheimer's Society page itself, and there are resources that you can navigate from there. But clearly, as you go further down the track of your end of life and towards the mid stages of dementia, there are other carer organizations. So Anuja mentioned, some of the other carer organizations are also providing sort of care. So the short answer, it is very fragmented, and you do have to find your way through all of it. But hopefully there are resources out there through the Alzheimer's Society. There is a helpline number which I've also shared. So if there is any question that you have, give them a call, go to the website, navigate some of those things, go to some of those things. A lot of this, sadly, is incumbent upon yourself as a family member or somebody who's been diagnosed to try and navigate this, because we don't have a system which we are trying to advocate. This is what we're trying to advocate as our society, which is as soon as you get your diagnosis of dementia, you should have a dementia support worker who then helps you navigate this entire, availability of help, which is either via our society or through other partner organizations that we work with. But it's so important at the moment that care is so fragmented that people find it really difficult. Unlike if you have cancer, in which case, that care is immediately available as opposed to having to go and find it. So, sorry, a long-winded answer, Nirmal, but it's a fairly complex area.
Manish, just adding to that, so the care that we're looking at the moment is mainly state-sponsored care. If there was private care, is that any different? And do you still get everything in one place if you were going through the private route? Or the private route doesn't exist in this now?
I think these are all complementary services. So sadly, if you have the financial resources and you are above the means tested threshold, you have no choice but to access the private care, because the state will not support you, or the local authorities will not support you. And this is where I think your social care webinar that you did before, and we may touch upon this in a subsequent webinar to the extent that there is interest around it, which is for dementia people, it is even more difficult, right? Because you do need something not for a short period of time, but it could be for 5, 10, 15 years. And how do you have that care, because that care is actually changing throughout that time. So in a sense, it's important to talk to people who are the experts around this, certain care organizations, because in a way, early stage, some of the technology stuff that Vivek and Rajal talked about and Fiona talked about, you have access to that. So early stage of your dementia journey, you may not need that much help. Mid case, you may need more support, and towards the end, as Anuj also highlighted, there's a whole heap of support that's required. So that support and care will change over the course of that person's journey, but it's important to then access that, whether it's through the state or privately, depending on your own financial situation, sadly. Hopefully that will change, but it's something which, again, one last sort of plug for us for society is that without the funds and support, we can't continue doing all of these things, because these services are free to anybody, but at the same time, they're only free because of the support that we get from people who donate to us. So please help, donate, volunteer, because again, there are not enough volunteers from the Asian communities to help other people with dementia. So that's another plea.
I think I just wanted to just add one thing in there as well, is anyone who is struggling with having to manage the care requirements of mum, dad, whoever it might be, with dementia, can always reach out to the Alzheimer's Society or other charity groups who might be local to them. And actually a lot of them have offices in local areas. But also you can actually just reach out directly to care businesses and not feel kind of any way kind of stigmatized about going out for professional help, because people will always help and they'll always be there to give you some advice. And also help you understand whether you can get local authority funded services or whether you should be looking at privately paid funded services as well. So I just wanted to drop in as well, that's exactly what Mum Rajal does there. So if you needed some support on that, I'm sure she can help in that as well as Manish and Anuja and everyone else in the group.
Excellent, thanks.
Can I do the last question, please, now?
Yeah,
because
sure.
we've gone over time. Sorry. Our last question, or maybe a double part question for Anuja, please. Anuja, is there a difference in behavior of male and female patients?
I'm not aware that there is a difference as such. All the symptoms, I've seen aggression in women as well. I've seen, all kind of symptoms in women as well.
And do dementia patients suffer from swallowing?
Yes.
Yeah, that's one of these.
Eventually almost everyone suffers from swallowing difficulties, and hence they need thickened fluids and pureed food, and eventually, they can have what we call aspiration pneumonia, because they aspirate the fluid into the lungs, and which actually takes them away from us often.
All right. I think we've run over deliberately. We went over a little bit because we just wanted to cover off as much as possible. But again, before we finish, a very big thank you to all of you, Manish, Fiona, Dr. Anuja, Rajal, and Vivek, for a fantastic presentation and a great question and answer session as well. For those of you who found our webinars helpful, this will be recorded and it will be going on our CAT8 webinars channel on YouTube. All our other webinars are also there, so please feel free to look at them. We are also trying to help the elderly and vulnerable and those in isolation and key workers, and our numbers on the slide at the moment. And also we have a helpline. Next slide, please. Yeah, that if you have any further questions, please feel free to call us or text us or SMS us or message us. In terms of where we are, at the moment, we are going to not do any more webinars until September time now. Next week, as I mentioned early on, is the Jain Holy Festival of Aspiration, and we hope that all of you celebrate that very well. And we will be sending out an email shortly giving you details of some of the activities which are being done by organizations that we've been working with. For example, SCVP are actually carrying out Pratikaman in English on every single day on 8 days. So please feel free to join them. And also One Jain is doing a special Das Lakshan and Paryushan opening on Saturday, but you'll get details of this. So like I said before, from CAT8, if we have done anything wrong or hurt your feelings in any way, Michami Dukaram to all of you. And, please join us for the other webinars. When they come out, we will be sending out details to everybody. So thank you for attending today. Be safe, stay alert, control the virus, and save lives. Goodbye.
Goodbye.